right, we're here talking to Dr. Patel, a dentist. Dr. Patel, hi, how are you?
I'm doing well, thank you. How are you doing?
Wonderful. Dr. Patel, tell us, in which city do you practice, and what type of dentistry do you practice? What is your practice all about? Every practice has some type of philosophy, and tell us your philosophy in your practice, please.
Sure. We are here located in Langhorne, Pennsylvania, which is in beautiful lower Bucks County in the state of Pennsylvania. And we have a very large facility which is oriented and geared towards mainly a patient-centric dental facility. What I mean by that is, everything we have all of our staff members trained on is just concentration on giving the patient the best outcome and satisfaction in creating every patient who walks out of here in an appreciative manner. This is all abiding by what our mission statement, as a matter of fact, is based around, which is pretty much, the satisfaction of patients come from educated, understanding the needs of patients and just moving them towards making better decisions for their dental health as well as their overall health.
Well, wonderful. And of course, just for the fact, you mentioned that you have a rather large practice. In almost all cases, there might be some exceptions like with everything else, but in almost all cases, if a business is growing, it means it is servicing the customer, because in the end, it wouldn't matter what you do. It wouldn't matter how good a particular marketing campaign for a particular business would be. It will dead end if the service doesn't give the customer what he wants. So you having a large practice actually speaks for itself that you are fulfilling your mission statement. Would you say so? Yes?
No, absolutely. One of the advantages of a large practice is not based on the success of the business model. The reason for the large facility is we're a multi-specialty dental facility. We have multiple doctors here. One of the good things in dentistry is, look, you have your strengths and weaknesses. Every single doctor does. And, when you have a large facility with multiple providers in it, to service the patient best, we feed off of each other. So if a doctor is not comfortable doing, for example, an extraction, in a 1 or 2 man practice, the patient would be referred to a specialist elsewhere. Whereas in a multi-specialty facility with several doctors in the practice, we can feed off of each other, like I said, and, we can jump in and out and aid other providers in accomplishing, again, what the patient walked in here for, rather than sending them elsewhere to have treatment done and then having them come back.
I think that's an extremely important point, because, most of us want to be serviced by the person who does one thing good. And I think you made an important point of saying it doesn't matter in which profession we are in it. We don't do everything well in that profession. There are other people, some people who do certain things better than others for whatever reason. It's not important. And it could get even worse than being referred out, which in itself is a hassle, delays treatment. It's just a complicated and cumbersome thing. It could even be that the doctor decides, well, I do it anyway because I need and want that patient and I don't want to send him out. I'm not all that good at it, but let's do it anyway. That's
right.
another little thing which could happen in a small practice. Well, he knows how to do it. He's trained on it. But as you said, why not make sure that everybody gets the best person for that specialty? Wonderful. And your practice is also, I've seen pictures and part of it in one of the books your father wrote. It's quite a nice place to be in there. It's very soothing.
It actually is. When we built this practice a few years ago, this was a philosophy that my father had created. It has been passed down to my generation. My sister is also was involved in the making of the practice with all the philosophies that he had instilled and he had passed down to us. One of the biggest things that he has studied over the course of the 38 years that he practiced was patient psychology. No one wants to go to the dentist. Patients do not like being at dental facilities. So when this practice was created, one of the things that he had taken into consideration, along with the input of all the managers and the staff that has been with him for the past 25 to 30 years, who are still part of this facility, was, look, we want to design a dental practice in such a manner that the patient does not feel as though they're sitting in a dental practice. It is a very state-of-the-art dental facility. A lot of technologies that make the patient visit a lot better. But going back to the design of the practice, we took a lot of considerations such as earth tone colors, blues and greens, which are soothing to the patient's mind. Nothing in the red category or the red families. We have a lot of curvatures in the practice throughout that kind of gives you a sense of no sharp ends, just a nice global sort of a touch, more organic feel. We've done plenty of patient surveys, as we occasionally do. And, I'll tell you this, 95 to 97% of patients who have visited this facility while sitting in the dental chair do not feel as though they're sitting in a dental office. So
I want to get a toothache right away so that I can come.
There you go. That would be great.
Wonderful. Dr. Patel, thank you very much for sharing this with us. Very interesting, and I'm sure the patients listening to that will, take notice of it and say, well, that sounds like the type of practice I might want to go. I like the part about being multi-specialist, having many people, so it wouldn't matter what it is, one is taken care of. And of course, feeling like not in a dental office is a good thing. Thank you very much, Dr. Patel.
Thank you very much. Take care.